Welcome to this evening's virtual chat. Through our virtual chat series, Cambridge Memorial Hospital Foundation is committed to share the amazing people and programs of CMH with you. October is Breast Cancer Awareness Month, and tonight we will introduce you to breast cancer survivor Melanie McCallum and General Surgeon Dr. MacLeod. Your moderator this evening is Lisa Short, Executive Director, Cambridge Memorial Hospital Foundation. After this evening's chat, you'll receive a link to the chat, and we encourage you to share it with family and friends. As a virtual chat registered participant, you are muted and not on camera. We cannot see or hear you. So sit back, relax, and enjoy.
Good evening, and thank you all for joining us. I see many friendly names, and on occasion there were a few faces there, but I think everybody's been put on, their cameras have been stopped, so your feed is free, as Inez mentioned, to sit back, relax, and enjoy the show. Inez also mentioned that I'm the Executive Director here at the Foundation. The Foundation exists to raise funds for our hospital, and I can assure you that it is our mission and our passion. I am also one of many in my family that was born in this hospital or have counted on the services here for some of our first hellos in our families and in our family, and of course, some of our difficult last goodbyes. This is my community hospital too. And like you, I want the very best when our friends, our family, and our neighbors need it most. These chats are intended to keep you, our community partners and donors, informed, educated, and connected. And as you will see shortly, a way to share stories of hope and community, stories like Melanie's. We are excited about the future of our hospital, our programs and services. Wing A, which just opened just prior to the pandemic, has been vitally important in our ability to respond. And the renovations to our B wing are underway as we continue hospital redevelopment. Once complete, CMH will be the most up-to-date hospital in our region. That said, we will be going through some growing pains in the coming months and years, so we'll look for your patience, but I can assure you signage is good, and there's lots of folks that are around the hospital trying to help guide people their way if you do have to come and visit us. As a foundation, we recently launched our Caring Programs series to help share, educate, inform, and inspire our community. Caring Programs provides information about key programs, the CMH team that provide care, memorable patient stories, and ongoing needs for equipment and technology at CMH. I hope you've seen our ads and our social media about the programs, including our recent surgical program ads, which are pretty impressive and feature some members of the surgical team and the surgical suites. I encourage you to visit our website for more information about Caring Programs. If you do follow us on social media, you would have noticed that we are sharing many stories of gratitude this month. Please do take a look at, as throughout the entire month of October, our focus is on gratitude for CMH champions. CMH champion includes patients like Melanie, doctors like Dr. MacLeod, and people like you who in so many ways continue to support our hospital. This evening, we would like to start by sharing a video with you created by one of our guests and breast cancer survival grateful patient, Melanie McCallum. Wow. Melanie, thank you for starting us off. and for being willing to share your cancer journey at CMH. As I understand it, this video represents your last day of treatment. Is that correct?
That is correct. Yep.
Wow. What compelled you to share your story with us?
Well, first of all, I just want to say thank you very much for this opportunity. I'm extremely grateful, as you put on my slide. And I just want to say good evening, everybody, and thanks for joining us. You know what? People are diagnosed every single day at Cambridge Memorial Hospital with cancer and other life-threatening diseases and illnesses. My story is no different. I was diagnosed in December 2019. And I believe that the team at CMH saved my life. So I just want to share my story with you. And although I don't think that my story is unique, I'm sharing it to let people know that in my case, the expertise, the care, and the equipment that I needed to get through my breast cancer diagnosis was available to me at CMH. And I want people in Waterloo Region to know that they can go to Cambridge Memorial Hospital.
So important for people to understand for sure. And I think that we've all had instances in our own life when we've been really happy that CMH is here for our family. Can you tell us a little bit more about your experience at CMH?
Sure, I can. So my cancer diagnosis was in December of 2019. And it actually came as a bit of a surprise to myself as well as my family. So I had been away on a work conference, came back, and I went into the hospital on Monday in December for my biopsy. And I knew that I was leaving on Tuesday to go to Markham for business meetings, and I wouldn't be back in Cambridge until the next Friday. So I had reached out to my doctor and said, when you get the results from my biopsy, please give me a call and let me know what those are. Because again, I won't be back in Cambridge until Friday, so I won't be able to come into your office to get the results. So she phoned me and gave me the results. And I think she was a little bit surprised at my reaction because I was fairly calm. And I said, okay, please tell me what type of breast cancer I have. And then I said, thank you, hung up, and went back into my business meetings. So, yep. So basically, it was at a hotel in Markham that I found out. Spent the rest of the day in business meetings, and then 2 months later, I underwent a double mastectomy, and that was done by Dr. MacLeod. And then I got followed up with by Dr. Sawa as I prepared for breast reconstruction. So except for one visit, which was at another local hospital in our region, all of my tests, all of my treatments, everything was done at CMH. So that included 4 surgeries in 13 months, 2 ECGs, weekly blood work, 12 chemo treatments, 18 Herceptin treatments over the course of a year, 1 bone scan, 6 MUGA scans, and those were all done in nuclear imaging. And basically what a MUGA scan does is it just shows you the blood flow through your heart. And I probably had more COVID nose swabs and tests than I would ever care to count or imagine. But I want to let you know that all of those procedures took place at Cambridge Memorial Hospital.
Wow, that's quite an ordeal for sure. We're going to talk a bit more about the MUGA scans a little bit later, and maybe a little bit more on COVID as well. But what was the most important part of the care you received at CMH?
Sure. The most important part for me, obviously, was to get the best care possible, which I did. And honestly, until I was diagnosed, I had no idea that Cambridge Memorial Hospital had surgeons that performed cancer surgery. I had no idea that they could do cancer treatment and follow-up. So when I was diagnosed, I had a lot of people reach out to me and say, go to Hamilton, go to London, as well as go to Toronto. So everything from my mammogram to my biopsies to all 4 of my surgeries, diagnostic imaging, which would include like x-rays, CAT scans, ultrasounds, all of it, pharmacy, and medical day clinic. All of those services were available to me right here at Cambridge Memorial Hospital. So it was important for me and my family to remain close to all of us, as well as to Cambridge. So we really didn't want to travel outside and go to another city for any treatments.
Wow. And a huge shout out to Medical Day Clinic. We get lots of people saying just what a wonderful experience. If you have to be there, that's a pretty amazing group of people in medical daycare. So we'll give them a little shout out.
Yeah, for sure.
Melanie, were you aware at the time that 100% of hospital equipment that was available to you throughout your care at CMH was funded through the generosity of our community?
To be 100% honest with you, no, I wasn't. And I'm probably not alone in that. I would think that most individuals would never give it any thought and then just assume that the hospital has the equipment there. So that's another reason that I feel that sharing my story with the community is important. CMH saved my life. I believe sharing my story is a way that I can give back to our community. It's important for me to know that when others are diagnosed with threatening illnesses such as cancer or anything else, that they actually have access to all of the equipment that they need right here at CMH.
Well, we sure do appreciate your efforts to share your story and sharing within your networks the fact that hospital equipment requires community support. Melanie, the community will be hearing more about your story in our upcoming Trees of Caring appeal this November, for which we are very appreciative. If you could tell our audience tonight just one thing about your journey, what would your message be?
If it's okay, I'd actually like to share two things.
Yeah.
So first one is take good care of yourself. So go for your mammograms, go for your pap tests, go for your colonoscopies. Make sure that you get that done. It is very important. The second one is the hope and gratitude that comes from knowing that donors gave so that I could have access to the best equipment and care when it was my turn. I'd say the importance of the community rallying together to support and fund a hospital's equipment so that the staff have the tools to take care of all of us in our time of need would be my main message. So for everybody on the line, if you've got the means to support CMH, I certainly couldn't endorse a better charity. Certainly this year, my family and I are going to be making a donation in honor of all of the staff at CMH that took such great care of us.
Wow, Melanie, I know it means a lot to the staff. I know they're tired. I know they've had a difficult time. So I know support from the community and from you means a lot. On that note, with us this evening is Dr. Heather MacLeod, and she is the surgeon that performed your double mastectomy. And I thought maybe we'd ask you to introduce Dr. MacLeod to our listeners this evening.
It would be my honor to. So Heather MacLeod was born and raised in Thunder Bay, Ontario. From the age of 16, she knew she wanted to become a doctor. She won a President's Scholarship at the University of Western Ontario, and she completed her undergraduate degree in chemistry and biochemistry there. She stayed at Western to complete medical school. While she was in medical school, she did not know what kind of doctor she would become, but she knew for certain that she would never be a surgeon. Clearly, she changed her mind throughout the course of her studies, and boy, am I ever glad she did. She completed her training in general surgery through McMaster University, and she accepted a position in general surgery at Cambridge Memorial Hospital shortly afterwards. Since coming to CMH, Heather has been active in hospital leadership, and she's been a member of the Medical and Professional Staff Association Executive for the last 5 to 6 years. She has also been a good friend to the CMH Foundation, and she enjoys supporting the hospital through the various events and endeavors. She has a young family, and she enjoys spending time with them when she's not at work. They are very active outdoor recreationalists, and they enjoy biking, hiking, and traveling as much as possible. Now, on a personal note, I would like you to know, Dr. MacLeod, that day in your office, when you put your hand on my knee, and told my husband and I that you were going to make me cancer-free, that was a very important day for us. You said it with such sincerity that you actually made us believe you. So thank you very much.
Thank you, Melanie.
Welcome.
I have to tell you, it's such an honor for me to be here with you. And I'll never forget the day that I met you and your husband in my office. I don't think I ever will. So,
Thank you.
so know that too, you make an impression on us, and certainly the impression you've made on our community and our hospital, and everything you're doing here is just phenomenal and really inspiring. So thank you. It's my honor and my privilege to be here with you, and I wouldn't be here without you. So there we are.
Well, funny enough, Dr. MacLeod, I didn't run into you when I was at Western. I think we were taking slightly different classes, but it must be an incredible feeling to know that all that hard work from those years of study, as well as through the skills and the knowledge and the expertise that you have, certainly gives patients a sense of confidence and calm and a sense of hope.
Yeah, I think so. I think it's a great privilege to be able to do this kind of work and to be able to come to work every day and want to do that, want to come to work every day. And I know that's not what everyone faces when they come to work. So it's really a privilege. I think the other big point is that working here at CMH, with the equipment that we do have, we're able to provide these kinds of surgeries that are really unique and not available, in other centers in our region, and not available in other hospitals our size. So this is, especially the breast reconstruction, is a huge gem in Cambridge Memorial Hospital. And as we've already said a few times, it wouldn't be possible without the pioneering work of my colleagues that came before me and setting this up, without the assistance of numerous different programs within the hospital, our pathologists, our radiologists, and medical daycare, medical oncology, and radiation oncology in the region. So it's a huge program. It's amazing that this is available at Cambridge Memorial Hospital. One thing that was really amazing to me is when I started here, I trained in Hamilton to do my residency, and they do this kind of surgery, the kind that Melanie had, and other breast reconstruction surgeries. They do that surgery in Hamilton. And I had done more of these kind of surgeries in the first year that I started working here than I had seen in my entire residency in Hamilton. So just as Melanie said, I meet women with breast cancer regularly, and they don't know that we can provide this level of care at Cambridge Hospital. So it's really, it's just phenomenal work that's being done to be able to do this. And I just am so proud to be part of that.
Mm-hmm. And what brought you to Cambridge Memorial? Like, what was it? What happened there?
So again, not common knowledge, but when I graduated from my residency in Hamilton, there's not a lot of jobs available in general surgery, and it's still that way. So it's difficult for surgeons to get work, actually. So there was a job in Cambridge that got posted. I'd actually visited with Donna Gravel, who was a Cambridge recruiter, Doctors for Cambridge, and also the mayor of the city at the time, and had actually spoken to them about the possibilities before I knew that there was a position in Cambridge. So Cambridge was a nice sized community. It was close to Hamilton, where I did my training, and it seemed like a good fit for my skills. I was interested in working in a community setting and a community hospital. And it was just really a bonus to me that when I started here, I found out that this was a program, that there was a breast reconstruction program here. And I, came in at a great time where we were really getting off the ground with it and hiring some plastic surgeons with the talents to do this kind of work. So outside of the breast recon program, the equipment when I started working here is the best equipment I'd ever used. in the OR. So it was all not known to me when I took the position, of course, but I was really thankful and grateful when I came, and impressed when I came to find that this is the equipment I get to work with. So.
Well, isn't that neat? In Melanie's video, we were able to see some of the equipment that Melanie needed throughout her journey. And we have a photo of Melanie in our gamma camera for the special MUGA scan of her heart. That camera arrived 2 years ago, and it replaced our older model that was about a decade old at the time when it got replaced. And when we think of our own cell phones and the technology improvements between models, you can imagine the improved capabilities of our new gamma camera, including imaging patients in half the time with a lot more detail. And one thing that we promote at the foundation is just how much these advancements enhance patient experience and help our radiologists in diagnostic imaging to be more efficient and effective to testing, diagnose illnesses and disease. Having the best equipment is expensive. We'll talk a little bit about that. It's fascinating, really. For example, that gamma camera costs just under $500,000. Can you tell us about some of the equipment that you get jazzed about every day that you are required to perform surgery, and give us a little bit of a sense of the costs?
Yeah, I think that I get jazzed about. Every day I get to be in the OR, I'm jazzed about it. So I was in the OR.
I knew that about you.
Yeah. So not just with respect to the breast reconstruction program, but of course at CMH, we also have minimally invasive surgery programs. So we have a lot of equipment related to that. I know we're not going to talk about that specifically tonight, but that kind of work also I find really exciting and interesting and challenging. So I do like that part. In terms of the specific equipment required for Melanie's surgery, this is the SPY machine. So this is, well, there's a microscope on the left that is used when we have free flaps. So that's when we're doing breast reconstructing breast tissue with the woman's own belly tissue, and the flap is taken from the abdomen and transferred to the breast, and we have to do an anastomosis or join of the blood vessels, and so that's done under the microscope. Now, I don't actually use this equipment, so this is for the plastic surgeons to use. So I'm sure they get jazzed about this a little bit more than me, but it's still important, because if we didn't have this, then discussing reconstruction with Melanie from the get-go would have been a non-starter. So we do have options we have the complete range of options for breast reconstruction surgery at our hospital, and the microscope is part of that. And then for Melanie's surgery, the SPY machine is important, because that machine allows us to check the blood flow on the skin flaps and make sure that they're healthy so that they can have an implant for reconstruction. So that machine was purchased 5 years ago and costs $175,000. So we can also use that machine in general surgery when we're looking at blood flow for the intestine, which is surgery that sometimes we have to do on an emergency basis. So it is also used in other settings. So on this slide, we can see a few of the specialized instruments that we use in breast surgery. Not just in what we did for Melanie, but for everyday breast surgery. I just did a few of those today, and I used the neoprobe on the bottom. So that is a special tool to look and help us with sentinel lymph nodes and sentinel lymph node biopsies. In my practice, I use that for breast cancer surgery and also for melanoma surgery, where we need to sample the first 1, 2, or 3 lymph nodes in the chain of lymph nodes that drains the area where the cancer is. And it acts like a little Geiger counter to help me find a lymph node that has taken up a radioactive molecule that's been injected in the surgical site before the patient comes to the operating room. So that is, I think we have a few of those in the hospital, and that comes in that little piece of equipment is about $56,000. So we don't drop it. You don't drop it. The other instrument, which is really nice for breast surgery and probably for vacuuming under the couch, just kidding, is the breast retractor with the light. And so what that does is a retractor that we can attach a light to, so that when we're looking far into the breast flap, that we have good visualization and we don't have to wear an additional light on our head. So it's a nicer way to just make sure we can see and get good visualization. So that's a really nice instrument. And that comes in at about $1,400. And then on the top right, you can see the instruments from just a basic minor tray. And all those instruments would be used in regular surgeries, breast cancer surgeries, but also other surgeries like hernia repairs, I don't know, smaller other surgeries like maybe melanoma resection, skin excisions. And I'm certain that there's other specialties that use all this kind of equipment as well. So it's fairly transferable to some extent. And that minor tray costs $1,700. So a lot of the equipment is reusable. It isn't all reusable, but everything you've seen so far is reusable.
That's interesting.
Mhm.
And surgeon by day and comedian by night, I think is what we can call you for sure. And we're always grateful to have you at our events talking about these things, and it's always fun to spend some time with you. So thank you. You've really provided us with a sense of the equipment costs involved with surgery. In a typical year, as I understand it, there's about 8,500 surgeries, general and specialty surgeries that take place. And that's approximately 23 surgeries a day. Happily, our new Wing A includes 9 surgical suites, all of which feature the latest surgical innovations. Dr. MacLeod, we have a picture of one of our new ORs. And can you take us through and highlight some of the items within the room?
Sure. So this is what our new surgery suites look like. They're gorgeous. I just think, as an aside, I know this is a little bit different, but I'm so happy with the hospital and the A wing, and I just feel, when patients come to the operating room, when they come to the hospital and they come to these rooms, they can have confidence that we have the right equipment. It's so clean, and I think the atmosphere is just so much brighter and hopefully more inspiring to patients than the older ORs were. I mean, Melanie, you can probably attest to that. But we always had the right equipment. We always had the good equipment. And it's so nice now that our hospital outside looks like we want it to reflect the kind of work that we do. So from the inside, right? So in this room, you can see that there's the 2 lights. Now, normally they're both sort of high and not one almost on the ground, and they're pointing down and they're very bright. They are specialized so that you can change the diameter of the light, and you can change the degree of light, I suppose, or the brightness that's coming. They also have anti-shadow abilities, so that if your head goes in the way, you won't block out the light from your field. So that's a new innovation since these ORs came in. Everything is off the floor. You can't really tell that, but that's an important feature. And we can move these 2 booms, the vertical structures that you see. That's where we plug our equipment into, and we can move those around, and they're not on the floor. So they can be moved out of the way to give us more room in the OR. There's also a special air handling system to help prevent surgical infection or wound infections, and that creates a sterile, helps to create the sterile field around the patient. So that's really important. I would say that was also very important throughout the pandemic, because with the pandemic, especially at the beginning, we were not sure about whether the virus was airborne or aerosolized, and we had to make sure that the rooms were filtered fully before changing patients from case to case. And so having the system in place and having these ORs in place really helped us get on to the next patient a little bit quicker than our older rooms did. So I think it's really important for the staff here, gives us more room to work, allows our teams to be a bit bigger in the room. Sometimes we have a lot of people in the room. I mean, imagine for Melanie's surgery, there was myself, an assistant for me, 2 nurses on my team, and an anesthetist. And then for the plastic surgery team, there's Dr. Sawa from plastic surgery, potentially an assist for her. I don't remember, I might have been her assist that day. And then another OR setup and another OR nurse. So there's quite a lot of people in the room. There can be a lot of people. Of course, Melanie was there, and there's normally an OR table in the room as well. So, which you don't see on this in this photo. So there is a lot of equipment that needs to be in there. There's a lot of people that need to be in there, and so that takes up a lot of space. So having the space is really important. There's other really nice features about the room. I could probably talk a lot longer than you want me to, Lisa. But you know, we have better temperature control individually in each room, and we have speakers so we can have music. I think that's comforting for patients when they come to the room. And there was one other thing I wanted to say about the rooms. Oh, the other thing you don't see in this picture, well, you can kind of see it, but it's flipped sideways. Behind the light, the top light on the left is one of our screens. These are all high definition screens. There's usually between 2 and 3 in the room. And that's what we would use for any endoscopic procedure, meaning done with a scope and camera, or laparoscopic procedure done with a scope and camera. And the nice thing about that is we can move those screens much more freely than in our old ORs. So we can put them at levels that are better for our own vision. So we're not craning our necks or looking in a direction that makes it really awkward. So it helps with fatigue during the operation and just better visualization all around. So it's been really a treat to come into this OR for sure.
Yeah, this picture was taken early on when I think before when we were still doing tours, so it's not quite set up the way or looks the way it probably does now. But it's just such an impressive room to be in. And this particular one even has some, you can see at the top there, that's windows, which provide a bit of an idea of what the day is like outside, which I think is rare for operating spaces as well. So that's really neat. As a surgeon, Dr. MacLeod, I've always been fascinated by this. What does a typical day look like for you?
Yeah, I don't know. Every day is so different. And even if you plan the day, best laid plans, it can all change in a minute during the day. So really there's not a typical day. I would say for a general surgeon, we do a lot of different things. So we are in the office about between 1.5 and 2.5 days a week. And then there's 1 day in the OR a week, generally speaking. We also do endoscopy procedures, so colonoscopies and gastroscopies, scope tests. And that's 1 day every other week. And we also do minor procedures for things like small skin cancer excisions, cyst excisions, vasectomies, carpal tunnel surgeries, that kind of thing. So those are in minor procedure, which is a room similar to this, but not as much equipment, I would say. So we do a lot of different things. And then we also provide call service to the hospital emergency department. So if you were to come in, unfortunately, with appendicitis, then you might meet a general surgeon and you might come to one of our OR suites. So we are on call for general surgery emergencies 24 hours a day, 7 days a week. And between the 7 general surgeons that we have at the hospital, we cover that. So it's always interesting. That's one of the things that I like about this specialty. Our OR days start at 7:50 and they run till 3:30. And people sometimes ask me, how many surgeries do you do in a day? And sometimes I do 1 and sometimes I do 6. So it really just depends on what's needed. And in terms of, how has it been working through the pandemic? Because that's been difficult for sure. And we have had some ORs shut down and slowed down as we're in right now. So we've had to still make sure that we can get our cancer cases done. So we have a mandate from Cancer Care Ontario that any cancer cases need to be done within 4 weeks of surgery, or 4 weeks of the decision to go to surgery. So at least that's any cancers that I treat, the kinds that I treat. And so we've been fortunate at CMH that the hospital's made it a priority to actually honor the CCO requirements and get patients into surgery within that deadline. So we've still been doing well to do that. But I would say it has been a bit challenging getting to the OR in the last year and a half, and certainly patients have had to wait quite a bit. When we do a surgery like Melanie's surgery, it's really interesting, and it's really I'm going to say fun surgery to do, because I work with my awesome colleagues, and Dr. Sawa unfortunately is not here, but she's definitely part of the team. And it is really an awesome thing to work with the colleagues, my colleagues here. So I always enjoy when we get to collaborate, and yeah, it's really great. We get the best outcomes that way. So usually what happens is, as for Melanie's surgery, is I would begin and we would start with a mastectomy on one side and do the breast cancer surgery there, and then Dr. Sawa would start with the reconstruction once I was done on one side, and I would move to the other side and do that side if we're doing a bilateral procedure. So, and then
how long would that take? There's a
um,
question in the chat about that.
Yeah, that would take about 6 or 7 hours, I would say. It would take me about 3.5 hours to do my part, and then Dr. Sawa could start on her part, and I think her part would be about 3 hours. So it's always a bit different, hard to predict sometimes depending on what happens, but yeah, I would say at least 5 hours. And then yeah, and then you never know, any day anything can happen. So yesterday, for example, when I came into work, I found out that there was a number of sick calls, and we didn't have enough nursing staff really, but the nurses that were there made it work, and we ended up having to cancel a few patients. But we got the majority of the cases done. So, we just have to problem solve every day and take what we get every day. And as I said, it has been a struggle throughout the pandemic, but I have to commend my colleagues and the exceptional staff here for just giving their best every day.
Yeah, well, and we were going to ask you about the impact of the pandemic on your work, and certainly now, as you mentioned briefly, with nurses and sick calls and people being tired. But are there other things that you would say the pandemic has had an impact on your work?
I mean, I think it's added another level of anxiety and uncertainty for patients that are trying to access care. And definitely we see that. And I mean, Melanie, we've talked about it, that thank goodness we were able to get all your surgery done before the pandemic even started. I can't imagine what it was like and what it continues to be like for patients that have serious issues and serious medical problems, and they feel potentially that they can't access care. So that's been a real challenge, I would say. We certainly would want people to know that we're here and you can access the care, and we will get your care done. We will get your surgeries done. We will, get you the referrals that you need and the imaging that you need and the tests that you need. And it will happen. So I think that's been really challenging. People are dealing with a lot right now, and we can tell it's been a long haul, and it's been tough for many people in many different sectors, not just our healthcare system. But yeah, it's been tough for sure.
I can see it. I can feel it in the halls some days,
Mhm.
for sure, on many different levels, not just for the staff, but just as you see patients and all of those things. So it's like, I think we should acknowledge it's a difficult time for so many, for sure. What are you most proud of related to your work at CMH?
That's a hard question, actually. I'm proud of the work that I do. I'm proud of the work that I do with my colleagues, and I'm proud of the work they do. I think that we have an excellent team at CMH. I really can't state that enough, honestly. The best people I've ever worked with are here. So that's an amazing thing, amazing honor for me, and I'm very grateful for that. Yeah, I just think that our teams work so well together, our services work so well together, and surgery is a team sport. We say that often, and it really is. So I'm proud of the team, most of all, I would say.
That's pretty cool. So we have a lovely photo of your family, just switching gears a little bit. You're featured in Neighbors magazine. I'll get your autograph on your way out today. And we can, it's a beautiful picture of you with your family. When you're not at CMH, and I know you spend a ton of time here, which our community is so grateful for, but what do you like to do with your time off?
Yeah, well, you can see that we probably bike.
Yes, well, somebody
Um,
does. Yep, that's a
So
fat
that's
bike. Yep.
yeah, that's my little guy. He's 4 now, so he's just started school and he's very busy. And one of the worst things we can do is stay inside all day. So we have to find ways to get outside. And as Melanie said, we do quite a lot of hiking and biking and exploring in the area. So we didn't grow up here. So we find, different day trips that we can do, explore different communities. We live in Galt, so we always like going to downtown Galt and walking around, seeing what's new, what's the art installation downtown this week, and the light show on the old post office and that kind of thing. So really, I don't want to say homebodies at the moment, but a little bit right now, especially with the pandemic, and just exploring and being outside, exercising, biking.
I've seen you playing a little tennis there at the park.
Oh yes, we do play. I do play tennis, sort of. Although this season has been a bit of a wash, but hopefully next year we'll get in some more tennis. Yeah, when I moved there, when I moved to Galt, I joined the tennis club, but I had never played before, so it's a great center for that. So really close, and yeah, it's very fun.
Very cool. Dr. MacLeod, as you know, Melanie is our 2021 Trees of Caring signatory. And in her letter to the community, Melanie has shared that she and her family are making a gift to Trees of Caring this year in honor of all of those at CMH that took good care of her. Do you have any closing message to share with Melanie and those of us with us this evening?
Yeah, thanks. Melanie, your family is beautiful. Thank you so much for this this honor. Honestly, it's very inspiring. I'm always amazed that patients come into the office and they have a diagnosis of cancer, and we have to talk about that, and they're scared, and it's a time in their life when they feel maybe most scared and most vulnerable, and we come together and we come up with a plan, and we go through the treatment, and then I get to follow them for a number of years afterwards. And in that moment, there's such a trust that the patients have to place in me. That is such an honor, and I really don't take that for granted. So that's what inspires me. People that come in, they have to go through this awful disease process. They have to go through this treatment, which is no fun at all. And then at the end of the day, they come to me and say, thank you. And I think, oh my goodness, how gracious. So that I find really an inspiration, and just keeps me coming back every day, right? I just want every patient to feel the way Melanie does and have that experience. So that's, that's why I'm here.
Wow. Thank you both for being part of our virtual chat this evening. And Melanie, thank you for being our 2021 Trees of Caring signatory. Do you have any final messages for our listeners this evening?
I do. I actually only found out about the importance of donations from a community after I was diagnosed with cancer. I think it's very common for all of us to think, as I said earlier, that the hospitals just have all of this equipment and, amazing doctors like Dr. MacLeod and Dr. Sawa and the entire team, but it's a lot for the community to support their hospitals. So again, I'm very, very happy. My commitment now is to ensure that the equipment at CMH is available for other people that get diagnosed with cancer and other life-threatening illnesses. So I am very honored that you've asked me to be the 2021 Trees of Care signatory. And I encourage you, everybody on the line, to help us reach our $242,000 Trees of Caring goal that the hospital has set out. I personally have a goal for $15,000, and I'm very happy to say that so far I have 2 supporters, and I'm at just over $5,000 of my goal. So I still have quite a ways to go.
That's amazing.
Yeah. So it's just, honestly, Dr. MacLeod, has been my absolute honor and privilege and pleasure to meet you. My family and I say all the time that you are our lifesaver, and we are forever indebted to you.
Wow.
Thank you.
Thanks for it's the fundraising page is amazing. Thank you for doing that. That was your idea, and for that we're so appreciative. A link will be shared if anyone wants to help Melanie reach her goal and the Trees of Caring goal. So thank you so much. We have time for a few more questions. I think we're going to go for another maybe 7 or 8 minutes. So if we can just maybe answer a few more. And I think it sort of touched on what Dr. MacLeod said about your surgery took place just weeks before the pandemic, Melanie. How did that impact how you managed your follow-up appointments?
Oh.
You said you had a lot of swabs.
Oh my gosh, yes. So you know what, whenever anybody gets diagnosed with cancer, nobody, like Dr. MacLeod said, nobody likes to go through that. It's a very scary time in your life. But to have to go through it, like the chemo treatments by yourself, that was pretty tough. So how my family and I managed that was my husband was allowed to come to the very first treatment with me. And that was probably the longest one. I'm sure we were at the hospital from 8 in the morning till about 3 or 4 that afternoon. So he was there to support me, and that was fantastic. After that, it's like literally you're on your own. So between my husband and my son and my daughter, they would take me to the hospital every Monday and drop me off. So while I was in getting blood work done, they would go over to Starbucks, and thank God for Starbucks and peppermint lattes and scones. And then by the time I was finished my blood work, we would come back out to the Jeep and just sit. And usually we sat there for about an hour and a half. And at that time, the Merry Mask makers of Cambridge Memorial Hospital, who are absolutely amazing again, were making all the masks for everybody. So I would share my mask of the week with Instagram followers. And and so it got to the point that, the staff at CMH is, especially in medical daycare, I know you talked about it earlier, but honest to goodness, I would walk in after not like my second or third chemo treatment, but probably after I'd had a few chemo treatments. I would walk in, and of course, the nurses everybody knew me. So I would walk in and just say, honey, I'm home. And we would all kind of laugh and chuckle. And then, you know, you grab your chair and chemo starts. And we would just catch up on our lives and things like that. So very thankful for the amazing nurses. I don't know how they do it every single day in medical daycare, giving people chemo, but you know, kudos to them, and absolutely amazing. So again, just thank you very much for all, like, excellent care. I honestly, truly want everybody to know you can go to CMH. Like, there's no point in going to Hamilton or London or Toronto if you live in Waterloo region, because the staff and the team are just, bar none, they're just fantastic.
I mean, I think Melanie, you asked me that when I first met you, should I go to Toronto?
I did.
And I said, like, you can, but I don't know why you would, because it will delay your care. We're going to get your results faster here. We're going to have all the same options here.
Mm-hmm.
I mean, I'm happy to send you there, but I think that we can do everything you need right here. Oh, I definitely know we can do everything you need right here. So
Yeah, you proved that. Yeah.
mhm.
Yeah.
And I think that's if that's a message that people can take away, like not to even to consider all of the amazing programs and people and equipment at CMH. It would be nice if we could move away from that thought, right?
Mm-hmm.
Where the thought becomes, this is my hospital and I need care close to home. And you know, you spoke of it too, Melanie. I mean, you could then see your kids could help, your kids could contribute and be a part of your journey. And if you were further away, it would just complicate things in so many ways. So I think it's just so important to have access to the skills and the equipment here at Cambridge Memorial.
Yeah.
Yeah. If it wasn't available here, Dr. MacLeod, how would this impact the level of care provided to cancer patients for our community?
Well, I think specifically with the breast reconstruction program, if we didn't have the equipment that we had, we wouldn't be able to recruit the plastic surgeons that we would need to be able to offer breast reconstruction. So as I had said, that would be a complete non-starter. And for someone like Melanie, who wanted the surgery that she wanted, I would have to send her probably to Hamilton. I would probably send her to Hamilton, have sent her to Hamilton for that.
Mhm.
That Hamilton's the next closest center. So.
Wow. If anyone has any further questions, please do let me know. We will be sort of closing things off now, and I know Alex is putting a few things in the chat there. Most importantly, thank you to everyone for participating in this chat. Dr. MacLeod, Melanie as a patient, Dr. MacLeod as her doctor. Wow, it truly takes a community to make this place go, and if there is ever together makes it possible. It's my catchphrase, and man, we've proven that tonight. We can't thank you enough, both of you, for coming today. Lots of great women doing great things in our community for sure. So I'm grateful for that as well. As mentioned, we'll share the link to Melanie's fundraising page and a link to our 2021 Trees of Caring appeal. Do follow us on social media. There's lots to be grateful for in this community, and we hope it's a source of inspiration for you and happiness to go to our social media and learn more about some of the amazing things going on here at CMH. Our next virtual chat will take place on February 2nd in 2022 with Patrick Gaskin, President and CEO of the Cambridge Memorial Hospital. Good evening, everyone, and thank you so much for joining us, and have a great night.
Thank you.